Welcome back, everyone, to another deep dive. Today, we're tackling a pretty common complaint in general practice: fatigue.
It's one of those symptoms that can be really tough to pin down.
Absolutely. It can be frustrating for both the patient and the doctor, right?
Yeah.
So in this deep dive, we're going to try to unpack the complexities of fatigue and go beyond just, that simple feeling of tiredness.
And it is a really common problem. Fatigue accounts for a staggering 7 million office visits per year in the U.S.
7 million. Wow. Okay, so clearly it's a significant health concern.
Yeah.
And it's more than just feeling a little sleepy, right?
Right, exactly.
It's the whole spectrum of issues. But before we get into the nitty-gritty, can we maybe clarify what we're actually talking about when we say fatigue?
Sure. Yeah, I think that's important to define our terms. Fatigue isn't simply tiredness, but it's this persistent sense of exhaustion,
Uh,
difficulty initiating activities, and a reduced capacity to maintain them, and even mental fatigue.
so that brain fog.
Yeah, like brain fog, exactly. And sometimes it can even manifest as excessive sleepiness.
Okay, so we're talking about something much more than just needing an extra cup of coffee in the morning. Now, I know there are different types of fatigue depending on how long it's been going on. Can you break that down for us?
Yeah, so we categorize fatigue based on duration. So we've got acute fatigue, which lasts a month or less,
Okay.
and that often points to something transient, like a recent infection.
Makes sense.
Then there's subacute fatigue, which lasts 1 to 6 months, and that might signal something a bit more persistent.
Right, right.
And then finally, we have chronic fatigue, which is lasting for more than 6 months.
The real marathon runner of fatigue.
Exactly.
So as GPs, we're essentially playing detective, trying to figure out what's driving this fatigue in our patients.
Yeah.
But where do we even begin with that investigation?
Well, it all starts with taking a really thorough history. That initial conversation with the patient is crucial, and we need to go beyond just simple questions like, how tired are you?
Yeah, I can see that.
And really delve into their experience.
I imagine open-ended questions are key here, really letting the patient describe what they're feeling in their own words.
Absolutely. So, start with something like, what does fatigue mean to you? Or tell me what you're experiencing. And these seemingly simple questions can unlock a wealth of information.
Yeah, that makes sense.
We want to know when it started. Was it abrupt or gradual? Was it related to any particular events? Has it been stable, improving, or worsening?
Okay, so really getting a good timeline of their experience.
Right. And what's the daily pattern? Is it worse in the morning or the evening?
Yeah.
Are there any factors that alleviate or exacerbate it?
So really digging into those specifics.
Yeah. And crucially, how's this fatigue impacting their daily life?
Yeah, that's a great point. We're not just looking at the physical sensation of fatigue, but also its impact on their work, their relationships, their overall quality of life.
Exactly. And there's a really useful tool that we can use called the Brief Fatigue Inventory, or BFI.
Okay, the BFI, I've heard of this, but remind me, what is this exactly?
Yeah, so the BFI is a questionnaire that asks patients to rate their fatigue on a scale of 0 to 10 in various domains.
Okay.
So you're looking at things like general fatigue, physical fatigue, mental fatigue, and how it affects their work or their social activities.
So basically it gives us a more objective measure of their fatigue, right?
Exactly, yeah. And it also shows us how it's affecting them.
Makes sense. So we've got the timeline, we're getting a good description of their experience, and we're using tools like the BFI to quantify the impact.
Yeah.
What else are we looking for in this initial conversation?
Well, associated symptoms,
Yeah.
those are really key.
Okay, tell me more.
They can help us narrow down potential causes. For instance, if a patient mentions snoring and feeling unrefreshed, even after a full night's sleep, we might suspect sleep apnea.
Yeah, that classic presentation.
Yeah, exactly.
Yeah.
Or dizziness and weakness could point to anemia.
Right.
Chronic muscle pain might suggest fibromyalgia. So, these accompanying symptoms are like puzzle pieces that can guide us towards a diagnosis.
It's like each symptom adds another layer to the story, right?
Yeah, exactly.
It helps us understand the full picture. Now, it's not just about physical symptoms, though, is it? I mean, mental health can play a big role in fatigue, too.
Oh, absolutely. Depression and anxiety are common culprits, and we need to be vigilant about screening for those.
Right, so using those validated tools like the GHQ-9 for depression
Exactly, yeah.
and the G87 for anxiety.
Right, and those can easily be integrated into the conversation.
Yeah, I find those are really helpful. And while we're on the topic of screening, we can't forget about substance use and the possibility of domestic violence. These are sensitive topics,
Hmm.
but they can't be ignored.
You're absolutely right. Fatigue can be a manifestation of so many underlying issues. It's our duty to explore all avenues.
So we've got this big picture of their fatigue experience, but now I want to zoom in on a specific area that I know can be a major contributor: sleep.
Right.
How do we assess sleep quality in the context of fatigue?
So sleep is crucial. And it's not just about the quantity, but also the quality of sleep.
Okay.
We need to know, are they getting enough sleep? Is it restorative sleep? And if they have a good night's sleep, does it actually put a dent in their fatigue levels?
Right. Is it actually helping?
Yeah, exactly.
Cool.
If not, then we might be dealing with a primary sleep disorder.
Like sleep apnea, you mean?
Exactly, like sleep apnea.
Which requires further investigation.
Right.
And then, of course, we can't forget about those sneaky culprits, medications. So many medications can contribute to fatigue.
Oh,
It
absolutely.
seems like almost anything can.
The list is long. We've got benzodiazepines, antidepressants, muscle relaxants, certain antihistamines, beta blockers, opioids, even gabapentin. It's essential to get a complete medication history, including over-the-counter medications and supplements.
Yeah, good point. It's all part of building that complete picture. Their history, their symptoms, their sleep, their medications. It's like putting together this giant jigsaw puzzle. But before we get lost in all the pieces, I think it's time to move on to the physical exam.
Yeah.
So while a general exam is always good practice, with fatigue, we really want to focus on those specific areas that might give us those aha moments.
Absolutely.
So what are those key areas we're zeroing in on?
So first, you want to observe their general appearance. How alert are they?
Okay.
Is there any psychomotor agitation? Or conversely, are they exhibiting slowed
Like we
movements?
see with depression.
Exactly. And then we want to look for signs of thyroid disease. Check their pulse. Is it too slow or too fast? Is there a goiter? Any skin changes or eye problems?
So we're essentially putting on our endocrinologist hat for a moment. What else are we looking for?
We're also checking for swollen lymph nodes or an enlarged liver or spleen. And we can't forget the neuromuscular exam, looking for things like muscle wasting or changes in their tone or strength, and any abnormalities in their reflexes. We also want to assess the cranial nerves and get a sense of their cognitive function.
Okay, so quite a comprehensive exam, even though it's targeted. So we've gathered a lot of information from the history and the physical. Now, I'm assuming it's time to bring in the lab tests,
Right.
but we're not ordering every test under the sun, are we?
You know me better than that.
I hope not.
A targeted approach is key. For chronic fatigue, we start with the basics. A CBC with differential, a comprehensive metabolic panel,
Yep.
TSH, and a creatine kinase if there's any muscle pain or weakness.
All right.
We might also consider screening for hepatitis C and HIV based on risk factors. And of course, age and sex-appropriate cancer screening is essential.
So we're being thorough, but judicious with our testing. And the big question is, how do we take all this information, the history, the physical exam, the lab results, and actually arrive at a diagnosis?
It's like piecing together that jigsaw puzzle.
Yeah.
Sometimes the picture's clear. Let's say the lab tests reveal abnormal liver function.
Okay, so pretty obvious.
Yeah. Well, that points us towards further investigation with viral hepatitis serologies and a hepatic ultrasound.
Right. But what happens when those initial pieces don't quite fit and we're left with an incomplete picture?
That's where experience and clinical judgment really come in.
That art of medicine.
Exactly. If the initial workup doesn't give us a clear answer and there are no red flags, sometimes the best approach is watchful waiting. We reassess in a few months, repeat those baseline labs, and see if anything new emerges.
Okay.
The key is to resist the urge to order a battery of tests without a specific direction. A low pretest probability just increases the risk of false positives and then leads to unnecessary anxiety and further testing down a rabbit hole.
Yeah, we definitely want to avoid that. So we're being mindful of not over-testing and potentially causing more harm than good.
Yeah.
But what about those cases where we've ruled everything out and the fatigue persists? Are we just left telling the patient, you're tired, deal with it?
Definitely not. That's when we start considering idiopathic chronic fatigue.
Yeah.
Or if they meet specific criteria, chronic fatigue syndrome or CFS.
Right.
Now, it's important to note that CFS is a diagnosis of exclusion, meaning we've ruled out other potential causes.
Okay.
And it actually represents a minority of chronic fatigue cases.
Hold on. You said CFS is a minority. What about all those patients who don't meet the strict criteria for CFS, but are still struggling with debilitating fatigue?
That's an excellent point, and it highlights a crucial aspect of managing fatigue.
Okay.
Even if someone doesn't fit neatly into that CFS box, their experience is valid and their suffering is real.
Yeah, that's reassuring. We're not abandoning those patients.
Right. The definition of CFS is intentionally restrictive, mainly for research purposes.
Okay, I see.
But many people experience chronic fatigue that doesn't meet those specific criteria. But their need for support and treatment is just as important.
Absolutely. So we've talked about the what, the why, and the how of diagnosing fatigue. But the real question is, how do we actually manage this complex beast? I think it's time to dive into that in part 2 of our deep dives. All right, so we've tackled the diagnostic maze of fatigue, but now for the real challenge. How do we actually help our patients manage this often debilitating condition?
It's tempting to jump straight to treatments and therapies,
Yeah.
but I think the most crucial element in managing chronic fatigue is the doctor-patient relationship.
So we're talking about that human connection, that sense of understanding and empathy. But how does that translate into concrete actions, when we're face-to-face with a patient who's struggling with fatigue?
Well, think about it. These patients are often exhausted, on multiple levels, physically, emotionally, even mentally.
Yeah.
They may have bounced from doctor to doctor, undergone countless tests, and still feel like no one really gets it.
So validating their experience becomes really paramount. We're not just treating a symptom, we're acknowledging a person's suffering.
Exactly. It's about saying, I hear you, this is real, we're going to figure this out together.
Hmm.
And that collaborative approach extends to creating a management plan as well.
Instead of just dictating a course of action, we're really partnering with the patient.
Right. And it starts with understanding their goals. What are they hoping to achieve?
Yeah.
Is it returning to work, having the energy to play with their kids, or simply getting through the day without feeling completely drained?
Right, those individual goals.
Exactly. And then we need to set realistic, achievable goals tailored to each individual.
And be upfront about the fact that, managing chronic fatigue is often a marathon, not a sprint. It takes time, patience, and adjustments along the way.
Absolutely. And sometimes those adjustments involve getting a little creative, especially when we're dealing with what we call idiopathic or residual fatigue.
Okay, so that fatigue that kind of hangs around even after addressing other medical issues.
Exactly.
So that's where I feel like we sometimes enter uncharted territory, right?
Yeah.
What are some of the tools we have in our arsenal for these more challenging cases?
One tool that often surprises people is antidepressants.
Oh, antidepressants. Okay, so before you raise an eyebrow, we're not just talking about treating depression here, right?
Right, exactly.
I'm used to associating antidepressants with mood disorders. So how do they play a role in managing fatigue, even when someone isn't necessarily depressed?
It all comes down to brain chemistry. Certain antidepressants, particularly those that affect serotonin and norepinephrine, can actually improve energy levels and sleep quality regardless of mood.
Okay.
They help regulate those neurotransmitters involved in both mood and energy regulation.
So we're kind of targeting those underlying pathways in the brain that contribute to both depression and fatigue. But we're not just handing out antidepressants like candy, are we?
Of course not.
Yeah.
It's all about shared decision-making, weighing potential benefits against risks.
Sure.
We start with a low dose, titrate slowly, and monitor closely for side effects. And we're upfront about the fact that it can take several weeks to see any improvement.
Right, it's a process.
Exactly. And if there's no benefit after a good trial, then we discontinue and explore other options.
Makes sense. So what else do we have in our, fatigue fighting toolkit?
Well, cognitive behavioral therapy, or CBT, can be a game changer for these patients.
Now, CBT, I usually associate that with managing anxiety and depression.
Yeah.
So how does it apply to fatigue?
CBT is incredibly versatile.
Huh?
In the context of fatigue, it's about helping patients challenge those negative thought patterns that often fuel the fatigue cycle.
Okay. So those thoughts like, I'm never going to get better, or I'm too tired to even try.
Exactly. Yeah.
Okay. So it's about reframing their relationship with fatigue, giving them a sense of control rather than just feeling like a victim of their symptoms.
Exactly. And CBT can be tailored to address specific needs. We can focus on sleep hygiene, activity pacing, stress management, whatever is most relevant for that particular patient.
So really personalized approach, which makes sense when you're dealing with something as individual as fatigue. Now, I know you're also a big proponent of exercise therapy, but I have to admit, telling a fatigued patient to exercise Seems a bit counterintuitive at first.
I know, it sounds like a cruel joke, right?
A little bit, yeah.
But hear me out. We're not talking about pushing them to run a marathon.
Okay, good.
It's about starting slowly, gradually increasing activity levels
Gotcha.
and focusing on activities they actually enjoy, like walking, swimming, gentle yoga, anything that gets them moving.
Okay, so manageable exercise.
Right. But the question is, how does exercise actually help with fatigue?
Yeah, it seems like it would just make them more tired.
It's about breaking that vicious cycle
Okay.
where fatigue leads to inactivity, which then leads to more fatigue.
Ah, I see.
Exercise, even in small doses, can actually improve sleep, boost mood, and increase energy levels over time.
It's like they're reclaiming their energy, their vitality step by step. But it's crucial to find that sweet spot, right?
Yeah.
Not pushing them too hard too soon.
Absolutely. We want to avoid exacerbating their fatigue.
Yeah, of course.
That's why it's often helpful to involve a qualified physical therapist or exercise physiologist
correct.
who really understands the nuances of fatigue and can create a safe and effective program.
So we've got this multi-pronged approach. We're addressing underlying medical issues, considering antidepressants when appropriate, and incorporating CBT and exercise therapy. It sounds really comprehensive, but I'm wondering about prognosis.
Yeah.
What can we honestly tell our patients about what to expect?
That's the million-dollar question, isn't it?
Yeah.
For those without a CFS diagnosis, the prognosis is generally positive.
Okay, that's good.
But, and this is a big but, it's highly variable.
So no magic formula, no one-size-fits-all answer.
Unfortunately not. Some people bounce back relatively quickly, while others experience lingering fatigue for months or even years. And it's important to remember that fatigue has been linked to a higher risk of mortality,
Oh, wow.
particularly from cardiovascular causes.
That's a sobering thought.
Yeah.
It really underscores the importance of taking fatigue seriously, even if we haven't found a clear-cut, medical explanation.
Exactly. And we also need to be mindful of the psychological toll that chronic fatigue can take.
Yeah.
Studies have shown an increased suicide risk in people with idiopathic chronic fatigue,
Wow.
highlighting the need for ongoing support and vigilance.
It's a reminder that fatigue is a complex issue with potentially serious consequences. We've covered a lot of ground here, from diagnosis to management to prognosis. I'm feeling a bit more equipped to handle these challenging cases now.
Me too. But before we wrap up this part of the deep dive, I want to leave you with one final and perhaps unexpected thought.
Oh, I do love a good cliffhanger.
Yeah.
Lay it on us. What's the parting wisdom for our fellow GPs battling fatigue in the trenches? I'm all ears. What's this unexpected thought?
Well, it's about seeing fatigue as a signal, not just a symptom.
Okay.
It's our patient's way of telling us something's not right, even if they can't really articulate exactly what that is.
I like that. It really shifts our perspective from just trying to fix a problem to really understanding what the problem is in the first place. We're not just, treating fatigue. We're listening to what it's trying to tell us.
Exactly. It's about seeing the whole person, not just their symptoms.
Yeah.
Their struggles, their hopes, their fears. They're not just coming to us for a diagnosis. They're seeking understanding, guidance, and ultimately hope.
It reminds me of that saying, people don't care how much you know until they know how much you care. I think that applies so much to how we approach fatigue in our patients.
Absolutely. Sometimes the most powerful treatment we can offer is simply listening with empathy and offering a genuine human connection.
So we've journeyed through this intricate world of fatigue, from unraveling its various forms and understanding its impact, to navigating the diagnostic process and exploring a range of management strategies. It's been quite the deep dive.
It has. And I think the key takeaway here is that fatigue, while complex and often frustrating, is not insurmountable. By approaching it with a combination of knowledge, compassion, and a willingness to think outside the box, we can truly make a difference in our patients' lives.
And that difference goes beyond just alleviating their fatigue, right? It's about empowering them to regain control, to reclaim their energy and vitality, and ultimately to live fuller, more meaningful lives.
Well said. And remember, the journey doesn't end when they walk out of the clinic door.
Yeah.
We need to be their advocates, connecting them with resources, providing ongoing support, and helping them navigate the complexities of chronic fatigue.
It's about being a partner in their journey, not just a prescriber of solutions. I think we've given our listeners a lot to think about, a lot to take back to their practice.
I hope so. Fatigue is a common challenge, but it doesn't have to be a defeat. By approaching it with curiosity, empathy, and a commitment to ongoing learning, we can help our patients find relief, reclaim their lives, and rediscover their energy and joy.
Well, thank you so much for guiding us through this deep dive into fatigue. Until next time, everyone, keep asking those insightful questions, keep digging for those hidden gems of knowledge, and keep making those meaningful connections with your patients.